Hello everybody, my name is Valeria Ferrari and today is a very great day because I'm glad to introduce you Dr. Nino Cacioppo. He is one of our key opinion leader that is really focused in digital dentistry. So for us, it's a big pleasure to doing a course, an online course with him. So I hope you will enjoy it. And before starting, please, I would like to wait a few minutes again because I know that there are some other participant that I still have to connect to the platform. So please wait a few minutes and we will start in 3-4 minutes. Thank you.
Valeria, if you want, in the meanwhile, we can talk about, if you want, about the next webinar.
Yeah, I mean, today is just the first appointment with Dr. Cacioppo, and we will have another second appointment, the 18th of May. And in that case, we will go deeper in some details about the prosthetic procedures and how to prevent failure, and starting from the basics, so the provisionals, and going to the final case, and also the most complicated case. So today is the first appointment, and I mean, the title is quite interesting, Teethan-based dentistry, why, when, how. So it's so amazing, that kind of approach that you usually teach to your also colleague and also students, because as you read in our email, Dr. Nino Cacioppo is a professor at the University of Catania, and is so charismatic, as you will see in the next minutes. He has a very good attitude. He can teach and explain everything about teeth, and also in general, of course, about digital dentistry and dentistry. So I think we are ready to start because it's 6:33, so they will connect meanwhile, but no problem. I would like to ask you just a favor, if you can write your question in the chat, and I will read it. I will read them at the end of the webinar in order to not interrupt the presentation. So thank you again, Dr. Cacioppo. It's a big pleasure for me, and we are here. Enjoy. Thank you.
Thank you very much, Valeria. Okay, let's start. Hello, everybody. I'm very honored to be here, and this is the first one of 2 webinars. And today we will talk about, of course, about Teethan, about what I called Teethan-based dentistry. It's a different approach to if you want, to digital dentistry. Let me introduce myself before starting. As Valeria said before, I'm mainly a private practicer. I live and I have my private practice in Palermo, in Sicily, Italy. But I've also had a teaching activity as a professor of prosthodontics in the University of Catania. I'm very addicted to that technology since maybe since ever. And since 2005, my dental office is 100% digital. Everything I do in my dental office nowadays, and we are 11 people in my dental office, and every one of us is addicted like me, or so to digital dentistry. And also, as a teacher, as a professor, I love to teach everything I know, everything I love about technology, about the different approach we can have today to dentistry. It's a different state of mind, a different approach, like I said before, and even with the young students. So let's talk about, before starting our webinar about Teethan, let's talk just a few slides about digital dentistry. Of course, we already know, of course, the dentistry and digital dentistry is a main topic, is a not topic nowadays. Dentistry is essentially made of 4 steps, as we already know: the anamnesis, diagnosis, therapies, and follow-up. But it's very strange, and I want to share with you this thought. When we think about digital, even in dentistry, we think about this kind of cases: big rehabs, a lot of digital stuffs, 3D softwares, CAD softwares, in-lab procedures, great rehabs, like I said before, with everything is possible in digital world. But it's not so common for us, and for me also, to think about diagnosis. It's absolutely a shame, let me say, and I want to explain, of course, this approach to the question. It's absolutely easy to think about the concept that a good dentistry starts from a good diagnosis, nothing more simple. And it is not possible to have a good therapy without a good diagnosis. So today we will talk, of course, we will talk about Teethan, of course, but today we will talk about dentistry, digital dentistry. Teethan, to me, is one of the most important technology in digital dentistry nowadays. But the main question we have to ask ourselves is, what are the main goals of digital dentistry? Let's start thinking about this. The first aim, the first goal we want to achieve is doing everything we did before. It's not so clear to understand it, because it's absolutely the basis. I don't want to lost, okay, everything I did before. Maybe in less time, with less discomfort also from the patient, and of course to reach better performances. This is absolutely very important. But if this is true, what are the technologies? Which are the technologies that are involved into this kind of digital approach? A part of the microscopy, I'm just 2 or 3 slides about microscopy, but it's not absolutely, to me, it's not a technology. Microscopy, it's absolutely a state of mind. It's a decision, and it's the basis for everything. Like I said before, we are 11 people in my office, and each one of us work under microscope. So we won't talk about microscope. And of course, there are a lot of technologies nowadays in the world. We are in 2020, but some of these technologies are maybe most important or more important than others. Sorry, my English is not perfect. So to me, the 3 main technology are the CBCT, so the radiological diagnosis, and we'll talk just a few minutes, 1 or 2 minutes about CBCT, the intraoral scan, absolutely, and the Teethan. And look at this. I won't talk about electromyography. I'll talk about Teethan. There is a different approach. It's very different. Okay, we will see in a while. So what about CBCT? Every one of us know CBCT in 2020, and you, like me, know very well that nowadays you can use the 3D X-rays in everything in dentistry, in surgery, implantology, endodontics, periodontics, orthodontics, in what I call daily dentistry. This is absolutely very important. It's absolutely very important to me, and maybe also for you, if you want to change, to have a revolution in your dental practice. Of course, we can use lower dose, we can use high resolution, we can have better images, we can have a lot of details from these kind of images. We can see with our eyes, not imaging, but see the reality. We can have an immediate feedback of what is, not what should be. Okay, this is, for example, 2D X-ray on the left and 3D X-ray of the same patient on the right. So of course, this kind of technology, it's not only very useful in diagnosis and in, of course, in therapy if you want, but or in follow-up also, but also in communication. And nowadays, it's very, very important to communicate with our partners, our teammates, but also with the patients. It's very important in 2020. And everything we did, we do with this kind of technology, we can do before and after diagnosis and therapies. And it's very important. This is just an example of the workflow we can use nowadays. So before we start with diagnosis, before therapy, of course, the better the diagnosis, the better the therapy, and after we can check. The second step in what I call my daily digital dentistry is intraoral optical scan, and every one of you, like me, know a lot about digital intraoral scanning, digital impression. I started in 2005 with my intraoral scanners. Now I've got 7 of them in my dental office, and I saw to grow up this technology and becoming better and better and better and faster than before. And as many of you, of course I know that it's a revolution. You can digitalize your patient in real time. You can see, the scanner can see what you can see, but of course if you use double cord, it's even better. You can use it for great rehabs, but one of the coolest thing is the communication again. Okay, like for the CBCT before, it's real-time communication, less time to do what I did before in the past. Okay, but with 0 time. And a lot of tools. I can, for example, in this slide, I can check, okay, the undercuts in real time with my patient in the chair of my dental office. And of course, also implant scanning. It's absolutely digital nowadays. And in digital dentistry, through the intraoral scanning, we can reach every kind of results. Okay, 2 full arches or 1 full arch, or even the edentulous. Okay, it's absolutely possible nowadays, even the total edentulism. But again, one of the most cool features of this kind of technology is 0 time. It's very fast, it's very comfortable for the patient. It's done on the chair. It's absolutely not so obvious. Okay, and you have got a lot of tools, and you can see, you can do your diagnosis, and you can communicate this diagnosis with your patient in 0 time, no time. And in the video on the right of your screen, you can see, but we will talk about that later in this webinar. You can see one of the coolest tools of digital impression. That is the virtual contact paper. Okay, keep in mind these words. The third, and to me absolutely the most revolutionary technology, or one of the most revolutionary technology that I've got in my digital dental office, It's absolutely the Teethan. It's very clear to me. I started working with this kind of approach in 2016, and nowadays I'm completely addicted to Teethan-based dentistry. But let's talk about that. What is Teethan? I don't know if you already are a user or you already know a lot about Teethan, but maybe not. Okay, so we can spend some slides and some words about what is Teethan. Teethan is a device for electromyographical examination. That's absolutely not new. When I started my studies in the university, maybe 20 years ago, I studied electromyography, but maybe I didn't use it in my dental practice before Teethan, because maybe because I'm lazy like a dentist, but because it's not easy. Okay, I understand the advantages of neuromuscular feedback and analysis and so on, but too much time and it's too difficult to read all the traces and the curves and so on. I don't have any time. Okay, I don't have so much time. The Teethan is absolutely different. It's a device for electromyographical examination, but it's totally different from anything from the past. Why? Okay, let me explain you. It's very easy for me, because most of all, it was designed from the spin-off. There is Teethan company, a spin-off of another company. It's a bigger company, of course, but a spin-off for dental use of this technology, designed on the profile of dentist of me. Okay, because I'm a little lazy. I don't have so much time to spend with technology when I work at the chair. I don't have I can't pay attention to a lot of softwares, a lot of graphics and so on. I don't have this time. Okay, and of course this is different from the past, because it's easy, it's very easy, it's very fast, 5 seconds and everything is done. It's absolutely with no wires at all. It's wireless, totally wireless. This is very interesting to me. And most of all, it's repeatable, it's reliable. You can have 10 examination and the results are very stable, and you have a lot of numbers, but in a few seconds, in absolutely an easy way. You don't have hundreds of thousands of values, okay, from this kind of examination. That is absolutely a good goal to me in my private practice. Okay, you have just a few data to examine and to take into account for your diagnosis, of course, for your analysis of occlusal point, and every one of these values is referred to occlusion, because this is for the dentist. Okay, this is very important. You only have 4 probes. You can see also in the webcam. Okay, 4 probes for 4 main muscles. Okay, the 2 temporal muscles and the 2 masseter muscles. Nothing more easy than that. Okay, 2 on the right and 2 on the left, of course. And what the software does is to analyze and compare the work between one muscle and another. For example, the POC of the temporal. Okay, it's the prevalence. It is most prevalent the temporal muscle of the right or the left, or maybe there is a perfect balance. The POC of the masseter, okay, it compares the two masseter muscles, or two couple, okay. The barycenter is absolutely the comparison, the balance of two couples from one side, two couples from the other side. On the other side, the two temporals versus the two masseters, and so on for the torsion, asymmetry, and so on. Because if we want to make a simple scheme, we can say, of course, it's only a schematization, and it's very simple concept of a totally different or more complex reality, anatomical, okay, physiology. It's not so schematics, but we need to be schematic, okay. If you want, we can say that the masseter muscle, it's related to the molars and to the posterior region of our occlusion, while the temporal muscle, it's related to the anterior region, so the cuspids and bicuspids, or even the incisors, if you have some contacts, of course. And if we want to draw an image, okay, we can say that this is the representation of the muscular activities on the occlusal planes, both on the upper and lower jaw. Okay. Another example, another simple example. If we can imagine the four muscle we want to study, the two masseter and two temporals, on the occlusal plane, for example, on the lower jaw, we can imagine that in ideal condition, there is a perfect balance between them, and there is a center of gravity, okay? And every single pre-contact, every single alteration, okay, of this balance, for example, just like I said, a pre-contact, it's absolutely seen from the Teethan, okay, read from the Teethan, and we can have an higher value of the activity of that muscle. For example, if we have a pre-contact on the 3.6 area, we will have, sorry, okay, just a minute, some problems with my battery. Technology, it's a good thing, but we need no more batteries. Okay. Only 5 seconds. And I'm ready again. Okay. Like I said, if we, for example, we will have a pre-contact on the 3.6 area, we will have the barycenter on the posterior of the occlusal plane and on the right side, and we will have a prevalence of the masseter muscle of the right. Okay. On the contrary, another example, if we will have a pre-contact on the 4.3, 4.4 area or region, we will have the barycenter on the anterior side of occlusion, okay, and of course a prevalence of the temporal muscle of the right. The impact is a very useful value to me, because it means that the sum of, analyze the sum of all the four muscles, okay. You have to imagine that you have, if you have all the four muscles with a higher work, a higher value, this may be related to the loss of vertical dimension, okay. Of course, we are clinician and we are non-mathematics, and there is a perfect results, okay. It's not mathematics, okay, it's clinical, but it's related to the higher the muscle activity of the 4 muscle, maybe the more there is a loss of vertical dimension. On the contrary, if you have low values of muscle activity, maybe this is related to higher vertical dimension. Just for example, if you think about an occlusal plane with a bite plane, okay, a bite splint, when you have an increase of vertical dimension, you have more relaxed muscles, so low values of activity. And this is the impact. It's very simple. And you have all this data in just a few seconds, 5 seconds. One of the most important and most interesting aspects of this kind of approach, of this kind of device, there is Teethan, it's that because of it, it's simple and fast. You can, and it's related to what a dentist want to imagine, that is the occlusal plane and not muscles, the occlusal plane. You can use it in 100% of your clinical practice as a dentist, of your 100% of your patients, okay? And this is a totally game-changing, okay? Sometimes it seems very easy to judge and to analyze 2 patients, two mouths like this. Of course, these are only 2 photos. But if you stop thinking now for just 5 seconds, okay, we analyze this kind of situation. These are implant retained prosthetics on the left and mixed rehabs on the right, implants on the upper side and natural roots on the, of course, prosthodontics on natural roots on the lower jaw on the right side. But we can't only analyze aesthetics, that is obviously important, and of course the implant health, and so I don't know, the CBCT post-op and so on, and the contact points with our eyes and contact paper, okay, because there is something it miss something, okay, it's missing something, and maybe this is the muscular feedback, okay. Are you pretty sure that this kind of patients are okay or not? They have pain or not? They have TM joint disorder or not? And most important thing, this is also related to fractures sometimes. If you don't have a well-balanced occlusal plane, if you don't have the right vertical dimension, you can have a lot of failures, a lot of fractures of ceramics, for example, okay. This is another difference, but it's not so easy to judge, to analyze, to have a diagnostic process, a diagnosis, okay, because on the left you can see a deep bite. It's very easy to think about a vertical dimension, a loss of vertical dimension. And on the right side, are you pretty sure that everything is okay? I'm not so sure, but okay. The problem is that nowadays, in the digital era, in 2020, in the modern dentistry, we want to have more data to analyze, and our patients, of course, to have a better diagnosis, because this is the secret to have a better therapy. There's no other secrets. Okay, and we need a compass. Okay, it's like a compass to me, the Teethan, to understand the occlusion. Okay, what is the right direction for diagnosis and for therapies, of course. Okay, And this is what I do in 100% of my patients. They undergo an intraoral scan, okay, like this, for example. They undergo a complete Teethan examination during the first visit, okay, when they are in my chair, okay. This is how I install the probe. The first one, then the second one, the third one, and the fourth one, okay. After the installation of the probes, this is in real time, okay. We have to calibrate. We only need 2 cotton rolls, nothing more easy than that. 5 seconds of calibration, and after that we can acquire as many choose as many occlusion, as many proofs we want, just in 5 seconds. Okay, this is the first one, but we can have the second one. We can simulate the maybe a rise up of vertical dimension. We can so an increase of vertical dimension. We can test or simulate a construction of the bite, or a bite plane, a bite splint, everything we want. We can check provisionals and so on. And after 5 seconds, we can use, like I said before, talking about other technologies like CBCT and intraoral scanning, we can use to communicate with our patient. That is very important. Of course, the most important thing is to have a better diagnosis, a better analysis of the occlusal plane. And these are just a few examples, and after that we will see just 3 clinical cases, okay, nothing more. And all of you are watching about on your screen the virtual contact paper, and maybe you are an orthodontist and you are thinking, okay, this patient maybe will need an orthodontist. Maybe you are a surgeon and you are looking at the lower jaw, look at the third molar, okay, they are not good, but let's concentrate on the virtual contact point. Of course, the same thing, it could be with the physical, the real analogical contact paper, but this is more easy to me, okay, to talk about digital, looking at digital file. And this is the same mouth, okay, the same occlusal plane with the Teethan examination. Now there are a lot of information that I missed before. Okay, I know that the prevalence of temporals, okay, is okay, but maybe a few on the left, and the masseters a lot on the right of the patient. There is a prevalence on the right. The bicenter is okay. There is a little torsion, and the impact, okay, the red light means something, it's not okay. The impact is higher than the standard percentage of after the calibration. Maybe this could be related to a loss of vertical dimension, maybe, okay, but we can check if you want. Another patient, another impression, of course, we already know, look at this, okay, that we don't have a complete occlusal plane because of the missing of one tooth. But are you pretty sure that the muscles of the patient are working well or not well? This is balanced or unbalanced. Okay, we have to judge also the pain, the TM joint disorders, everything we did before, it's okay nowadays. But I want more. I want some values, some numerical values about the activity of my muscles, or the muscles of my patient, related to the contact point and the occlusal plane of my patient. And this is the same patient with the Teethan examination. Okay, again, we can see an unbalance between the temporals, an unbalance. There are unbalanced on the left side, the masseters on the right side. The barycenter is on the anterior, and look at the contact point. Of course, everything is on the anterior. Okay, because you have the contact between the incisors. But I don't want only to see. I want to measure. Okay, I want a predictable and repeatable data, because at the end of the therapy, I want to check again. And the torsion, there is a little torsion, and the impact again is higher. So maybe there is a loss, just a few micrometers, a loss of vertical dimension. Of course, it's easy to think about it, because we don't have an optimal occlusal plane on the rear of this occlusal plane. Okay, it's missing a 3.6. Okay, the first one of the three clinical cases. Of course, this is only for to have an example of it. Okay. As you can see, it's very easy to imagine that this is a deep bite, to imagine that maybe there is a loss of vertical dimension. But can you tell me how much? Is it possible? Or I don't know, my lab can choose for me if I want to rehab this patient with prosthodontics or some kind of approach, or orthodontics if we want. But if I had to increase the orthodontics, is not the right way. Okay, and look at the right side, I have my 2D examination. So the steps are anamnesis, of course, a clinical and objective examination of the mouth. Of course, we have to talk with the patient, and we have to analyze 2D examination. After that, we can choose the 3D examination to analyze, for example, the two edentulous areas. Okay, if we want to rehab with by means of implants. And after that, we can have our intraoral scanning 3D models in real time, 0 time. Okay, 2 minutes. And look at this. Okay, this is what I want to see, to study, live study the mouth of my patient. Okay, and after that, in the same appointment, the patient undergo through a Teethan examination, a complete Teethan examination, 4 probes, 4 muscles, of course in the right position. The photo is not the right position, but it's only an example. And look at that, we now have some more data, okay, about that patient, that occlusion. We know that the impact is higher than I ever seen before, 219. Okay, it's very high. So I need to rise up, to increase my vertical dimension, and I can check. Now we will see. And we will also have a barycenter on the anterior. Of course, there is a lot of contact on the anterior. Okay, and we have a little torsion, a prevalence of the temporal, okay, on the left side, and the masseter are well balanced, not so unbalanced. And this is what we can simulate, if you want, in the digital era, in the digital world, or if you prefer, in with the whole approach with the gypsum in the lab. It's the same. It's the same. But I did this kind of simulation during my first visit with my patient in the chair with the probes of Teethan mounted. Okay, this is the examination of the occlusal plane, of contact points. I can rise up, I can increase the vertical dimension of 2 millimeters. Is it right? Is it not? Do you already know the 3 steps technique? But I don't trust only anatomy, only aesthetics. I want more. I want a success. I want that my patient will have no pain, no temporal disorders, TM joint disorder. I want to, of course, simulate in my software CAD, or my technician is the same. In this case, I chose this kind of approach, no prep temporary overlay, that I realized in my office by means of PMMA, through my milling machines, 4 temporary overlays on the right and 4 on the left. Okay, and this is the case. It's not a therapy. It's absolutely a first visit, but it's a way to simulate an increase of vertical dimension, okay, and to check this vertical dimension by means of my Teethan. That is the most important things, okay. And in the same visit, of course, it's like a trauma, okay, for my patient. It's like, wow, what happened? Because 2 millimeters more, it's not easy to accept. But in the same visit, these are the values, okay. Everything is better than a few minutes before, 1 hour before, okay. The impact passed from 219 to 73, totally different. And after of course, I started to follow up my patient every 2 weeks, and after 3 months, everything is perfect. The patient is absolutely perfect. No pain, no more temporary disorders, TM joint disorders. But this is not therapy. It's only, and this is the Teethan. Okay, after 3 months, everything is pretty well balanced, almost perfect. Not perfect, but almost perfect. But this is not therapy. This is just the starting point. Okay, the goal is to reach the right direction. Okay, now I know that this is the right direction. I want to maintain this vertical dimension. I want to maintain this balance between right and left, between the posterior and the anterior, and so on. And from this moment, through all the therapy, I can use the Teethan. We will see it together, if you want, on the next webinar, on the 18th of May. I can remember, but yeah, maybe the 18th of May, because we will talk about prosthodontics. But the secret is that you can repeat in every appointment, if you want, the Teethan examination. Okay, this is one clinical case. The second one, another case with a loss of vertical dimension. But okay, this is a very interesting case, because look at that. This is the first visit. Look at that bridges on the upper jaw. Okay, the criteria that I have to take into account when I evaluate, like a prosthodontics or like a general practitioner, if you want, when I had to evaluate an old bridge or 2 old bridges, it's aesthetics, the color, if we had the ceramic, okay, no fractures at all. But what about vertical dimension? Are we pretty sure that there is a vertical dimension in that bridges? Okay, the answer is no. I'm pretty sure that there is not. And we will see, okay, in a few minutes. This patient had a lot of pain, a reduction of the mouth opening, and disorders of TM joint, okay, both on the right side and most of all on the left side. Okay, this is the 2D X-ray The 3D X-ray, of course, I want to analyze everything before starting my approach with my relationship with my patient. Okay. Of course, in 2 minutes, 3D digital models. Okay, I can study all the models and the contact points by means of virtual contact paper if you want, or you can use also the real contact paper in the inner side of the patient mouth. And again, in the first visit, the Teethan, because I want to see the bone by means of CBCT. I want to see the anatomy by means of 3D models. I want to talk with my patient. I can't see the pain, but I want to talk with my patient, and I want to see the feedback from the muscles of my patient. Okay, it's like talking with the muscles. It's amazing. Okay, and you can see that everything is unbalanced on the left side. Everything, both the temporals and the masseter muscles. The barycenter is on the anterior, of course. Okay, and there is a torsion. Okay, on the left side, and the impact again, a lot of a value, a very high value. 160. These are the contact points. Look at that. Okay, contact points on the anterior, a lot of diastema. And this is contact points and Teethan. And we can see other indexes, other data from values from Teethan, the asymmetry. Of course, we have an asymmetrical mouth, an asymmetrical occlusal plane. And it's very interesting that you can also have a report in PDF. You can print, you can send by email to the patient, because it's absolutely numerical. It's absolutely based on values, measurable values. Okay, and this is the digital construction byte by means of the Teethan. If you want, we can see this one later in another webinar. Why not? This is a very interesting approach. Okay, this is not a simulation. This is the real open bite of the patient with some thickness. Okay, measured by means of the Teethan. Again, the same approach as before. No prep. Okay, it's only for diagnostical purposes. You can choose if you want a bite plane, but it's removable. It's not 24 hours a day. I want 24 hours a day, 7 days a week. Okay, this is a good time for having data from my patient, for having feedback from my patient. And again, I printed my models and have a mock-up on the anterior to avoid an open bite, of course. And I have two no prep overlays, not printed but milled by PMMA. Okay, nothing more simple than that. This is in the mouth of the patient. This is not the rehab. This is not even a provisionals. This is not. This is only a diagnostic way. Okay. The most important thing is it the right direction? Is it the right increase of vertical dimension? Well, I have to ask to the muscles. I have to ask to the muscle through the Teethan examination. This is the real revolution in 100% of prosthodontics, but 100% of first visit and dentistry. Okay, and this is during the first visit, just 1 hour and a half. Okay, everything is better. Everything is well balanced, and after a few weeks, my patient was perfect. No pain at all, no more pain, no more disorder. The opening of the bite was better, and everything it was good. So this was the right direction. Maybe But I didn't choose the direction. My patient chose the direction. The muscles of the patient chose the direction. This is the last case, and it's very interesting because it's totally different from the two we saw before. Because this is a first visit for an hygiene. Okay, a new patient, is well-looking woman, very young, 38 years old. Okay, nice, nice shape of teeth, nice smile. Everything seems to be good, but okay, again, the first visit, complete digital first visit. Of course, if you want some photos, some videos, some photos of the face for aesthetics, okay, you can speech, you have to speech with your patient. This is through my microscope, examination of the sulcus, okay, maybe could be some cavities, okay, some old restorations, okay, and everything is in front of my patient on one of my monitors. Okay, you can see these are the two monitors, two displays I use to talk with my patient. Okay, abrasions, okay, fifth class abrasions. Maybe she can't use the right way the toothbrush. Okay, we need to correct. And 3D intraoral scan, why not? I got one scanner in any room of my dental office, why not? 1 minute, 2 minutes, not more, okay. And we can see with the patient in front of him or her, sorry, we can see in occlusion, we can see through the contact point, virtual contact paper. And again, 2D X-rays, there is something wrong, maybe. Okay, the periodontal, it's not so good. Okay, let's investigate. Let's see the periodontics by means of a 3D examination of the same mouth during the same first visit. Okay. And of course, we can talk with our patient and we can have a better diagnosis. Okay, maybe she needs periodontal therapy and not only hygiene. And again, by means of my microscope. But what about occlusion? What about maybe is it an orthodontist patient? At the end, the patient undergo a complete Teethan examination. Why not? 5 seconds. It's very easy. It's very fast during the same visit. Okay, and this is the analysis of the same mouth of previous by mean from the point of view of the muscles. Okay, are we pretty sure that everything is okay? Because the muscles say maybe something is not okay, because the impact is okay, 89, perfect, but there is an imbalance, okay, between the right and the left. The temporal is unbalanced on the right, the masseter is unbalanced on the left, the barycenter is a lot on the anterior, okay, and there is a torsion. And this is the analysis of 3D models, the same 3D models as before, by mean, and the contact points, of course, with the Teethan examination. And look at that, okay, look at that. This kind of incisor contact, okay, It's absolutely confirmed from the Teethan. And again, we can ask the patient, are you pretty sure you are okay? Oh, okay, at this point she told me maybe sometimes if I chew for a long time, or if I eat a hard food, sometimes I've got some pain, and sometimes I've got some blood because of the periodontist, of course. Okay, and again, this is totally different approach, because we have more data to talk with of course, with also with orthodontists if you want, or collaborators, other colleagues, but to talk with patients, to have a better diagnosis with more data, and to talk with the patient. And that's it. This is a pretty simple approach. Okay, 3 or 4, in this case 3 technologies involved. The most important one maybe is Teethan.